So, to our audience, hello, and thank you for joining us. I'm Crystal Potter Rivera, Executive Director of Denver Health Foundation, and I'm pleased to welcome you to today's session of the Springboard series. Through the Springboard series, Denver Health Foundation invites community and business leaders, philanthropists, and program experts to join Denver Health CEO, Dr. Robin Wittenstein, in conversations around some of our community's most pressing challenges, as well as innovations in health, economic, and social solutions for our community. In this virtual setting, I invite you to use the Q&A feature to submit questions for our panelists to answer at the end of the discussion. So I'll thank you again for joining us for these important conversations and ask Dr. Wittenstein to introduce today's esteemed panelists.
Thank you, Crystal. I'm Robin Wittenstein. I'm the CEO here at Denver Health. And I have to tell you, I am extremely excited about the conversation we're going to have today. As you know from prior sessions, Denver Health is not only a safety net institution that is designed to care for the most vulnerable patients in our community, but has really embraced the idea of being an anchor institution, of addressing both the need for care and expanding access to care, but equally important, dealing with the root causes of poor health. And one of those root causes is very significantly related to economic well-being. So as we move forward, we've got Mayor Michael Hancock and John Hope Bryant with us, and I'm going to give you an introduction. I can't possibly do justice to either one of them, so I'm going to keep it short in the spirit of the time we have available. But Mayor Hancock has been the mayor of Denver for almost 12 years now. He is the 45th mayor of the city of Denver and has been living here in the Mile High City since he was 10 months old. I think what is particularly remarkable about Mayor Hancock is the focus that he has brought to the city of Denver in making sure that everybody who lives, works, and plays in the city can participate in the economic growth and opportunities that exist here. He has focused on the children who live in the city, youth, on homelessness, on making sure that the city is a safe and welcoming place for everybody who is part of this, and has really helped Denver to be and to become a city that is known for its growth, its development, and particularly for its welcoming environment for businesses, especially minority and women-owned businesses. Having been a resident here for just over 5 years, I can tell you that the city of Denver is an amazing place, and a lot of that is due to Mayor Hancock and the work he's done. In the COVID-19 crisis, Mayor Hancock and his entire team turned to dealing with the issues that have come out of COVID, not only vaccinations and keeping people safe as they come to work, but really focusing on vulnerable populations, on the people who had no choice but to come to work, oftentimes people living in poverty, people of color, and working to address their needs through that crisis, and has done an amazing job. Mayor Hancock has a BA from Hastings College and a master's in public administration from the University of Colorado in Denver. He has been a fixture in the city government for quite some time, having served on city council and been the president of city council for 2 terms. His career in building cities has been through the years, including having served as the youngest president of an urban league division in its history. So we're particularly thrilled. And equally impressive is John Hope Bryant. So John Hope Bryant has been referred to as the conscience of capitalism by a number of CEOs, including the CEOs of Delta Airlines, Walmart, and First Republic Bank. He's an entrepreneur, an author, a philanthropist, and a thought leader in issues related to financial inclusion, to economic empowerment of everybody, and financial dignity. He founded Operation Hope in 1992, and it is now the largest nonprofit, best-in-class provider of financial literacy training and education, as well as economic empowerment services. I am not even going to try to touch on all of the awards and citations that Mr. Bryant has received, although I will mention a few. He is a founding member of the Clinton Global Initiative. He was awarded the United States Minority Business Development Agency Advocate of the Year. He's a LinkedIn Top Voice U.S. Influencers. was named in the Atlantic Business Chronicle as the Power 100 Most Influential Atlantans in 2020. The list goes on and on and on. But I think one of the things that to me really encapsulated what Mr. Bryant has hoped for in setting up and moving Operation Hope forward is when he worked to inspire that the U.S. Treasury Annex Building was renamed the Freedmen's Bank Building. The legacy of the Freedmen's Bank, which was founded by President Abraham Lincoln, is the narrative of Operation Hope to help everybody in the invisible class become truly integrated into our nation's economy and be able to participate in the success of our economy, and to do what I often say is give people the chance to support themselves and their families in the same way that we all want to. So with that, thank you both so much for being here. I'm really looking forward to this. I will be taking a lot of notes because I'm sure I'm going to learn a whole bunch of new things that we need to be doing here at Denver Health. But let me start with some questions. And I'm going to go first to you, Mayor. You know, we talked a lot about how important health and well-being is to our patients, but to our community. And we know that a lot of the determinants of health have nothing to do with the clinical care that's provided. It really is what are referred to as social determinants of health or social risk factors. And we know in particular that housing costs are going up. There are challenges with homelessness, with transportation. Wages haven't increased nearly as much as the cost of living has. And this is really putting a lot of stress on people who live in our community. I sometimes look in the mirror and say, I don't know how these problems can be solved. But I also know we can't give up because people are depending on all of us to be able to come together. Your last year as mayor is coming up. As you think about what you've done and what you want to do, what are your thoughts about how we can really make these problems not be insurmountable, but move forward?
Well, first of all, Dr. Wittenstein, it is good to be with you. It's good to be with Christopher Potter Rivera as well, and the Denver Health Foundation, and part of this exciting, I think, discussion that's extremely important. And then my longtime friend and associate, Dr. John Hope Bryant, and he really is a doctor of everything. One of the guys who I love to hear speak about these very topics. And you asked a question that, quite frankly, has really served as a model for how I address a lot of the challenges that we face as a city. It's really the health model that I approach issues to working on their solvability or their solutions, and recognizing that not one issue that we deal with in the city, for example, we arrive at with just one solution. Otherwise, we would have solved it. Whether it's homelessness or it's involuntary displacement and gentrification in our communities or crime, we have to ask ourselves, what are the stacking or the piling of challenges that have led us to this point? When I meet someone who is homeless, who is experiencing homelessness, we recognize that there are probably a myriad of challenges, that the trauma, moments of trauma, or situations that this individual has faced in their life that has rendered them in this place, this station that they find themselves today. And so oftentimes, unfortunately, a lot of our constituents expect us to be able to wave a magic wand or to implement one solution that solves the problem. But the health model tells us, if I see one symptom, there's probably another symptom there, but there usually are one or multiple challenges that are causing these symptoms to occur. And so we got to peel back the layers. We got to keep asking a lot of questions to get to the solution. And I think that's really the opportunity that exists with regard to financial challenges. You and I know that most of us are one paycheck away from a crisis. We're one health crisis away from being absolutely debilitated financially. And what we have to do is to work on those various contributing elements: lack of education, lack of opportunity, lack of transportation mobility, lack of tools to build wealth, access to home ownership, for example, lack of real basic education around how to manage my finances, or heck, to start my own business. Those are the things that we've got to kind of investigate with every individual who's facing the crises or dealing with stress around financial management. I see it in my family, with my brothers and sisters, their children, but I also see the opportunities. As I was the first in my family to graduate from college, I've now seen numerous nieces and nephews of the clan of 41, I call them, nieces and nephews, who graduated from college and not only graduated from college, but now have master's degrees or maybe double masters. And so we can see how they are now homeowners and they're living more comfortably than my generation of siblings. So these are the things that I think we can, there are silver linings there. We kind of understand now how people are, dealing with a lot of these crises, but also begin to remove themselves from being in the line of fire, or at least what I would consider on the most vulnerable plank in our life, particularly when it comes to finances. So how we solve them is being honest and acknowledging that the problems that we face are much more multi-pronged and the solutions are much more multi-pronged than we would like to admit.
No, it's interesting. I too am the first. I mean, neither of my parents graduated from high school. I'm the first person in my family who went to college, and I had the same thing. Nieces and nephews who now have gone on to college, and they're starting their lives in a very different way. Mr. Bryant, a question for you. It seems as if so much of the issue, so many of the issues really come back down to economics. I mean, that's certainly not the only thing we're dealing with in this country, but it is a huge issue. When you started Operation Hope, what were you really what did you think you could accomplish? And what have you been able to, or where do we need to go to deal with some of the lack of financial understanding, financial opportunity that we see nowadays?
Well, first of all, I want to acknowledge you and Crystal as two role model leaders there in Denver. It's pretty inspiring for young girls to see you, to know that's who they can be. I want to acknowledge my friend, the mayor, who is a model mayor for this country. My only regret is that the solutions I think we've tripped on now, we didn't trip on a decade ago when he was starting his mayoralship. I really think that he has got the kind of vision and mindset to really make this a national model out of Denver. I don't have to talk him into it. Success is a habit. If you hang around, it's also a culture. So if you hang around 9 broke people, you'll be the 10th. The opposite is also true. Think about what the mayor just said about successive degrees in his family. Think about that. It's not a mistake. And when you deal with poverty in the communities I grew up in Compton, South Central, when I founded Operation Hope in 1992, 2 months ago, 30 years ago, April 30 years ago, I realized, doctor, that there's a difference between being broke and being poor. I've been saying this for 30 years, that being broke is economic, but being poor is a disabling frame of mind, a depressed condition of your spirit, and you must vow never to be poor again. After you deal with sustenance poverty, a roof over your head, food on the table, reasonable health care, all other poverty is mindset. And that mindset affects your health, affects your mental health, and whether you do have a surviving mentality, a thriving mentality, or a winning mentality, and winners are builders. So Operation Hope has really been about eradicating poverty as we know it in our lifetime, which sounds lofty and ridiculous until you understand that it's the mindset and the culture piece that we're after. I'm not nuts. I don't think I can eradicate literal poverty. But the most powerful, most eroding type of poverty is the one that ends with you having no hope. And the most dangerous person in the world, a person with no hope. That's the most damaging kind of poverty. Like, I know people who don't have any money who are very wealthy. They have the right mindset. There's a kid who came through one of our classrooms for financial literacy, and 10-year-old kid, and name is Derek. And after 3 sessions, he started wearing a suit like his volunteer banker teacher. And the kids teased him. His friends teased him. Man, why are you hanging around those bankers? Why are you wearing that stupid suit? And so he graduates the next session, the 4th session, is 1 per week. So his culture is sort of piping into him as he's watching this banker. And make a long story short, he's in the hallway, kids are teasing him. And I go to him and his friends and I say, look, I'll give you each $70 several years ago, $70, make a decision about Nike. You have 3 minutes. Friends said, we don't need 3 minutes. We're buying us some Air Jordans. And for which you need another $30.
Yeah, let's say.
Back then. And Derek says, no, I want to buy 1 share of Nike stock. Kids say, man, that's stupid. Why you want to buy some stupid stock? You need some Air Jordans. Everybody in school has Air Jordans, purple Air Jordans, leather Air Jordans, fuchsia Air Jordans. They start jumping on him culturally. I stopped. I said, look, I tried to defend him. And Derek said, no. It's cool. I want them to buy those shoes. Because when they do, they're making me money. See, Derek's mindset shifted as a shareholder, as a stockholder, as a wealth creator. So Derek might be broke in the future. Take risks, you're going to end up on the wrong side of cash flow, but he won't be poor. And that is what we've been eradicating. And we've actually found a way to tie that into science and formulas. I love math. It doesn't have an opinion. And the data now shows that this permeates everywhere into your health, your wellness, your attitude, your depression or lack thereof, your hopefulness, the ability to, that then translates into GDP, job creation, small business creation, entrepreneurship, home ownership rates. So that was what I thought 30 years ago. 4 million clients and $4 billion invested later through our partners. As large as what we do in the country is what I know to be the case now. And we now have data that proves the problem is solvable. There is good reason to be hopeful. And we have data there in Denver because I have 5 offices in Denver. At the right point, I'll tell you some of the outcomes. It's pretty impressive, even there in Denver.
Hey, Dr. Wittenstein, can I just jump on something that John said? I don't want us to miss this point. This is a pin. It's so important that we acknowledge it. He repeated a line that I have used over and over again. A person with no hope is the most dangerous person there to exist, right? When we look at situations like many of the justice protest march, social justice protest march that we saw, or we look at major crime or murder statistics in places like Chicago, Illinois, one must stop and ask the question, at least my first question is, I want to know what the economic condition is of that community. I want to know what the average income is, what average wage is of those individuals, or not individuals, but of the community as a whole. Home ownership of where are these young kids coming from who are shooting and killing one another? Because ultimately that will tell you where the unhealthiness exists in a community and where there is a lack of hope. And then what you see playing out, I would say to people during the social protest march, this is about George Floyd, but if you think it's just about George Floyd, we'll never solve this problem. It goes all the way back to people who are just challenged financially, who are stressed, and have had enough. Said enough is enough. So we've got to, that's what I'm talking about, peel back the layers and deal with those social pillars that are challenging us in the community.
I agree. And, I've said oftentimes in the conversations I've had with people about why the hell is Denver Health even getting involved in what? And it really, for me, comes down to exactly that. It is people who look to the future and see nothing better for themselves and their children have no reason to be anything other than angry and frustrated. And we have got to find a way to give people back hope that they can, by virtue of the work they do and the support we give them, that they can have a better future for themselves and their children. I agree. John?
I want to give some data underscore what the mayor and you just said. The mayor, now we didn't talk before this. This is just free flowing. But Ambassador Andrew Young would say, coincidence is God's way of remaining anonymous.
I love it.
George Floyd was in a 500 credit score neighborhood when he was murdered. Every in-place shooting of a Black at the hands of a police officer that we have viewed as unfair, because not all shootings are unfair. Some people, there are real bad guys out there, is what my point. But in the ones where we have viewed these to be unfair, oppressive situations, all of them in neighborhood have been 500 credit score neighborhoods, all of them. Let me give you an interesting data point. The poorest state in America is Mississippi. The lowest credit score state in America is Mississippi. Let's look at Denver for a second. Now, Denver's doing pretty good as this goes. Actually, financially, you guys are pretty impressive. But My data people sent me a zip code. The mayor would know this. Your highest income zip code is 80108. You guys probably live there. The credit score is 752. I've already said there's never been a riot in a 700 credit score neighborhood in all America's history. 700 credit score neighborhoods go shopping. Two-parent household, Starbucks, two-parent, higher education. But zip code 80010 has a credit score of 646, which actually is not that bad on average. I got credit scores here in Atlanta that goes into the low fives or high fours, but that's an average income of $38,000, 80010. And there's a 100-point difference between that and the wealthy zip codes in Denver. And my guess is if you look at your crime data, your single parent household data, your educational data, your homicide data, you're going to find most of your problems are around 80010. And it's not because these are bad people. These are good people, but you model what you see. If all you see in your neighborhood as symbols of success are rap stars that you can't reach and you can't emulate because they're singular, athletes, you can't replicate that model, are drug dealers, and you shouldn't want to emulate that, then why is anybody surprised that's who the people grow up wanting to be? Right. You model what you see. So the data is that we've just now unveiling data by zip code. I'm so giddy about this. You're the first people I'm telling this. I now have absolute empirical data that proves what the mayor just said by zip code in every zip code across this country, and it is absolutely verifiable. That is not about the credit scores, it's about the trending indicators of hope, well-being, belief, self-esteem, confidence, joy, stability that undergirds and sort of rides with or up or down the credit scores. So the economic reality will either trail or indicate your level of health. What does the number of people drive heart attacks from? Stress. Where does stress come from? Money. What is the number of calls for divorce? Money. What's the number one cause for domestic abuse? Money. Why does a woman stay with an abusive man? Money.
It's interesting. We belong to an organization, recognizing, and I would say the same statistics and the same correlations you mentioned in terms of this particular zip code, and there is definitely a set of zip codes in Denver where we know poverty is concentrated, and by virtually every measure, that's where we also have some of the problems you talked about, and health and well-being are equally related.
I was just about to say, yeah.
Absolutely. And we're actually working with an organization we belong to that has created what they are calling the vulnerability index, which goes down to the zip code level and looks at levels of income, of education, of home ownership, and correlates them back to use of the emergency department, hospitalization rates. And, there is absolutely a relationship between and among these things. And as you said, Mayor, it's about peeling back the onion and really understanding. So I guess my question, Mayor, Denver Health, who we are and what we do. I think one of the questions I get a lot, and I'd be interested in hearing your thoughts about this, is knowing Denver Health as you do, how do you view the role of Denver Health in dealing with the issues, not just of, are people getting immunizations when they're supposed to, and are they going, getting into the ED when they need to, but the role of an organization like Denver Health in addressing these kinds of issues?
Yeah, I think it's a lot of what you already do. One, being an anchor institution and recognizing the true essence and power of an anchor institution in terms of your presence, your employee, the fact that you're employing people with livable wages, and you're developing but delivering true top-notch world-class healthcare for people who cannot really afford it. I am blessed as the mayor to be a patient. My mother's a patient. When I became a patient, I made my mother be a patient of Denver Health. And I don't have any brothers whatsoever. In fact, I brag about Denver Health. So those are the givens of what you're called to do. But greatness comes from being able to permeate your mission and to make your mission come to life, right? And your purpose to really stand on its own. And when you ask questions like, how can we be more helpful in effectively helping those who are experiencing homelessness in our city, you are you are exceeding the walls of your institution. You are taking your mission and its purpose, and you're having it walk the city with boldness as a giant in the community. And that to me is powerful. Same thing with hunger. We've talked about food insecurity. You have addressed it. How do you educate mothers who most of the children never are born at Denver Health? How do we make sure that when those mothers walk out, they know how to care for their children? And so you're doing those things. You know, you and I had this conversation. So, when you buy a car, it comes with all kind of stuff, right? I got pamphlets on how to operate this car, if something goes wrong with this car, how to program the clock, how to program the GPS system, how to open the trunk from inside the car. But when I have a baby, I guess you make sure I have a carrier and a car seat, and then I'm told to go home and to care for this child, this little human being who's going to depend on me for most of its life. And you all permeate that. So, it's the same thing with those who are in front of you, because many of them, if not most of your patients, are financially insecure, meaning that they are that one paycheck away or one happenstance away. Maybe it's just a flat tire that needs to be repaired before they're facing a crisis. If that, they may already be underwater. Most of them are, based on what John is talking about, what he's dealing with. How do we make sure that they get connected to those additional services that help them with, maybe it's the Financial Empowerment Center we have here at the City of Denver that John and his team are major partners with us on, to help lift them up and come out of that debt, to face it and to deal with it, and to begin to build greater financial self-sufficiency.
It's interesting. I think healthcare in our country doesn't work particularly well, independent of the economic issues that our patients face. But I think we really need to address or to update, the use of the healthcare system, except in certain ways and certain circumstances, should be regarded as a failure of the system. But that's a topic for another conversation. John, I guess as Mayor Hancock described, Denver Health has decided that we're going to continue to provide clinical care. We're going to do the right thing by our patients to the best of our ability. But frankly, it's just, if that's what we do, then we are failing the people that we are here to serve. And so we have adopted this perspective on our role as being a vehicle of giving hope to people by economic empowerment, economic opportunity, economic mobility. And we're starting with our own employees. So our center, our Workforce Development Center, and Operation Hope is a big piece of that. Really is intended, especially for the employees we have who are at the lowest wage scale, to help them with financial literacy, but to go beyond that. The small loan program that we have, so that employees don't have to go to a payday loan and pay outrageous amounts of money when they get a flat tire, or the work that we want to do in terms of individual development accounts to help people save up so they can become homeowners. I think these are all critical parts of our program. But, we do hear a lot of mission creep. That's not what you're here to do. I argue that is exactly what we're here to do. We're here to improve health and well-being of the people we serve. And if it's by helping them be more economically secure, then that's what we're going to do. But what have you seen in other parts of the country as organizations have adopted working with their employees, their community, around some of the approaches that Operation Hope has taken? What are some of the successes you're seeing, or what advice would you give us?
Yeah, I think it's rather short-sighted for people to say this is not your mission. I mean, I don't even understand that, actually. Your financial health, your economic stability is directly tied to your spiritual and emotional health, or lack thereof. Most of my clients have a surviving mindset. How do you think they feel? You think they're full of joy and belief, or you think they're stressed out because they got too much month at the end of their money? Most people in this country don't have $400 for an unplanned event. Most people in this country are living from paycheck to paycheck. 70% of this country. That stress permeates and seeps into your psyche. Or as somebody told me growing up, disease can often be dis-ease. We're not human beings having a spiritual experience. We're spiritual beings having a human experience, and energy matters. The data that I am showing, that I'm slowly unveiling, absolutely underscores what we're talking about. Look, in some ways, I'm a frustrated spiritual doctor. In some ways, I'm masquerading as you, because what I'm doing is getting somebody from darkness to light. What we're doing is moving you from a surviving mindset, stabilizing you. But we're looking at data here. We moved credit scores there in Denver. We have 5 locations: Hope Inside, City of Denver. Thank you, Mayor. Hope Inside, Colorado Federal Savings. Hope Inside, U.S. Bank. Hope Inside, Denver Public Schools, College View Elementary. Hope Inside, Denver Public Schools, Johnson Elementary, and I think another one's going in there. And credit score increases 21 points from 596 to 619. Don't think that changed self-esteem, confidence, and belief? Median in savings change. Remember, most people don't have $40, plus $838, plus $838 per family. So think about somebody who has no savings at all. They're living from paycheck to paycheck, don't know whether you can pay rent next month, don't know whether you make the car note, don't know whether you can say yes to the kid for after school training. I mean, you're living in an anxiety-filled situation. You stabilize yourself, now you have almost $1,000 in savings. You have $838 with nobody's name on it. We've got 600 of our clients who've been referred to banks for mainstream financial services. So now you're out of the check casher, you're out of the payday lender, you're out of the rent-own store, you're out of title lender. Now you have the dignity of walking into a bank and getting prime rate mortgages, car loans, whatever. I'm still looking at here, we've created $6 million in new homeowners there in Denver. Mayor, those are new taxpayers. Yeah. I mean, this data and this average income here is $28,000. You're not talking about millionaires. You know, you're talking about hundredaires, thousandaires who now know they've got some air. It's called hope. This informs your health. And if you don't do this, it informs your depression. Yeah. And depression is bad for everybody. Again, it's circular firing squad. The most dangerous person in the world is a person with no hope. So I think it's just a ridiculous conversation to somehow disconnect health, financial health and health wellness. I think these things are, I'm going to go one step further. I'm convinced that financial literacy is a civil rights issue of this generation. And I believe that financial well-being is the new healthcare. Healthcare 30 years ago, 40 years ago was not presumed. It is today. Then health wellness, 10, 15, 20 years ago, we say now, health wellness, now it's a normal. But 20 years ago, people were like, look, we're not doing that. Now it's normal. I think financial coaching, financial well-being coaching in employers, that's one of the things we're pioneering. You're going to find that's going to become a norm because people are stressed out. And you're stressed out, you're not thinking about your work, you're thinking about that bill collector.
Well, and I will tell you, although our, so Mayor, I'm not sure if I even shared this with you. Our financial coach, who is part of Operation Hope, started at Denver Health on April 11th.
Oh, new. Fantastic.
Brand new. But John, we're going to beat all the statistics you just said. We're going to beat all of them. Started on April 11th, and we sent out a link for people to ask questions about the services. Within 24 hours, we had dozens already. The financial coach here is already doing not just financial literacy sessions, but is meeting one-on-one and doing financial coaching for employees. And we're starting with employees. Our goal is that our workforce development center, and it's not just financial, literacy, financial coaching, that's a piece of it, but it's also truly putting in front of our employees career paths and opportunities. You may come in at an entry-level wage, but we're going to work to provide you paid training and education so you can continue to advance. I've said probably more times than people want to hear, money is not the solution for everything. But when you don't know how to feed your children, it damn well is the solution at that moment in time. And the goal is to figure out not only how we bring people in, but we bring people in who are vulnerable. So our safe outdoor space, we're interviewing residents of the safe outdoor space for jobs here at Denver Health, because giving people the dignity of a future that they can pin some hope on is an important part of it. But I guess the question to both of you really is if financial hope for the future really is the answer for so many of the problems that we seem to face as a society, how do we get everybody to be part of this? How do we bring everybody into the mix so that every employer thinks it's part of their responsibility to do this. We're at the beginning of our journey. I can't tell you we've been able to solve this problem. And I don't even know how long it will take us. But the question is, how do we get everybody to want to do this, to be part of it, to give hope to people?
Mayor, you want to go first?
I'll let you go, John.
So look, I think you want to save the environment, introduce greed. You want to save our democracy? I hate to, the mayor can't say this. I'm just going to say, you got to introduce self-interest. Charity only goes but so far. You know, people say, I hate rich people. Some of my liberal Black friends, I hate rich people. No, you don't. You hate rich people till you become rich. What you hate is a game system. That's what you hate. You hate a system that you don't believe works for everybody. And so you're now upset, understandably so. You're upset with it. What I think we got to do is to convince the free enterprise system, the capitalist system, that there's 2 to 3% of GDP, gross domestic product, customers locked at 50% or lower in the economic strata. Our data that I'm now unearthing, zip code by zip code, absolutely proves this to be the case. If you can rehabilitate these folks, get them hopeful, get them to go from renting to home ownership, small business dreaming to small business owning, going to higher education, getting higher incomes, spending more money in that community, buying more homes, more mortgage, which is more mortgages, more cars, which is more car notes. Everybody in that situation wins. So the CEO of Walmart and I, Doug McMillon, #1 Fortune 500 in the country, have co-founded something called Financial Literacy for All. And our mission is to convince every Fortune 500 company in this country, well, we say 80%, to join within the next 12 months and to embed financial literacy into the business plan of their organization, not into their public affairs, not into their charitable operations, which is nice. No, into the business plan of these companies. Make a 10-year commitment, resource it appropriately, send a signal from the CEO level, and commit to embed this. We've already got the NFL, NBA, Disney, Delta Airlines, Walmart, a whole list of these companies, and every month, NASCAR, every month, 5 more companies, Wells Fargo, 5 more companies join. They're doing it because, well, they want new customers, yes, for the future. They also want their employees to know they care about them because they're having morale issues inside the organization. And they're finding that what we're talking about here is going to erode and corrode the culture. So I think we got to make a business case, and you can, for why this is viable. And I think that's what's going to make it stick. And, if you look at the data, Colorado's actually doing pretty good. 711 is the credit score. But again, Detroit's credit score is 622, which means that there's probably there's a bunch of folks in the 680, 700, but there's a lot more people at 500, 550. They're dragging the average score down. So if Detroit is an average 622, that doesn't bear well for what was once the richest city in the world. Detroit, 60 years ago, was the richest city in the world, richer than Paris.
Yeah.
If you pop the credit score 100 points, city by city, block by block, city by city, you change the country. I know it sounds ridiculous, but you just move the credit score from 500 to 600, or 580 to 680. That's a better than that. Crime goes down, all the stuff, homicides go down, all the positives come up because, again, 700 credit score communities don't ride, they go shopping. I think that it's an economic argument.
No, that actually, and you don't have to convince us that there is a business case for doing this. We're not doing what we're doing just because we're nice people. We're doing it because it matters to our employees, it matters to our business, and it will ultimately matter to our patients. Although actually, John, I think as you talk about the zip codes, when we get to the point where we're ready to move into our communities and really do the same work that we're doing inside the institution on the outside, it may be that leads us to the places we prioritize where we're going to take this first, because we're a safety net institution. Money doesn't hold us back, but it sometimes makes progress a little bit slower than we would like, and we may need to prioritize where we go next. But Mayor, I guess the question is, how can we get everybody in Denver to do this? How can we get every business to see the business case for why we are focusing on economic opportunity, not just broadly in the sense, people say, oh, everybody should have opportunity and they feel good about, but truly the people who work for me should have this kind of opportunity because it's good for all of us and it's good for our business. How do we do that?
If you talk to folks of, the baby boomer generation or even older, they'll tell you, I didn't want anything. I didn't want a handout. I just wanted to be able to take care of my family. I wanted to make sure that we were able to eat when it was time to eat. We had a roof over our heads. I talked to my mother and her peers who are in their 80s now, and these are folks who resist public service or public entitlements even today. They're like, that's not what we're here for. And so I think the majority of Americans recognize that only 1% of us will ever attain the place in life where we are financially, economically independent and will never need support or help from anyone. But what they look for is peace. They look for the less stress in life. That I think John and his team and comrades coach people to try to attain in life, right? So financial independence and self-sufficiency, not wealth. I mean, not overall wealth to where you're just, I can buy and do whatever I want, but I need to be independent and not be stressed. So what I look for and what I try to share with corporations is what you do is think beyond your walls.
That's right.
I'm not looking for anything special, but the phrase that I'm looking that often comes to my mind is selfless humanity. And so I'm going to take us back to the very beginning and just give you the root of what I'm thinking about when I say that. If I am Corporation X and I'm aware of the fact, like here in Colorado, it was announced not too long ago that we were running out of resources or the bill was dying where we would no longer give free breakfast to kids in schools or free meals in general. The concept that we cannot give free breakfast or free lunch to kids should have sent us, we should have been willing and ready to protest and walk in the tongues of thousands, because we cannot expect children to be hungry and then sit down in a classroom and expect to learn mathematics.
That's right.
You are now perpetuating the undereducation of our children, which will, quite frankly, follow them throughout their lifetime. And what we know about our education of our children is if they start out or fall behind before the third grade, they never catch up over their lifetime academically. And so to me, that is what springboards the lack of financial literacy, is springboard the lack of graduation rates, and we know what happens from that point forward. So I would encourage not only our corporate leaders and anchor institutions, but elected officials and just community folks as a whole, recognize where the root of our challenges come from. They start oftentimes very early and much earlier. To have a hungry child in a classroom is an opportunity, is a lost opportunity. And we've got to recognize that and do everything we can to avoid that.
So, I've shared a little bit about what Denver Health is trying to do, and there's so much more. But I guess the question, and I'm going to turn it around and ask you, not how do we convince others, but what else? What else should we do? What else should we be thinking about and doing with the idea that what we really want to do is to be able to not give a handout, but a hand up? How do we give more people a hand up so that they have hope in the future? Mayor, knowing Denver Health the way you do, what else should you expect of Denver Health? Or John, you've seen organizations and companies around the country embrace this. What else should we be thinking about if we're going to really help people achieve what they want for their families?
Hey, two things, because I know we're up against time, but here are two things. One is to recognize you can't do it all by yourself. And that is, what are the menu and slate of services that we need to make sure we can immediately tie people into, depending on their challenges and opportunities in the community. And secondly, you're a powerful anchor institution. Use your voice and continue to advocate on behalf of the most vulnerable by standing up and being willing to take risks. And that means you may have to offend some people in the room sometime. And so we cannot sit in this belly of opportunity while others are falling behind. And it's a major lesson learned for all of us. I had to learn that lesson at some point, even as a policymaker, and recognize that we've got to bring others along. And that means that we have to recognize equity, and that means that everyone starts at the same place. same station to take advantage of these opportunities when we may have to modify at times.
I think that we oftentimes make the mistake of assuming the leadership is the mayor's job. And what I would encourage you to do is to be not just a funder, but a convener, because your money's going to have limits. The Woodruff model is the one I'm going to suggest. Right here in Atlanta, there was a gentleman named Robert Woodruff. He was CEO of Coca-Cola. And Dr. King won the Nobel Peace Prize, and the business community here in Atlanta did not want to honor him. They called him a troublemaker or rebel rouser. And they called Robert Woodruff when he was hunting, brought him back in town. The mayor did, because the mayor couldn't, or had limits of what he could do, he thought. And Woodruff got upset. Get these guys in my office, the business leaders. He said, look, you guys messed up my hunting game. Let me make this clear to you. This man has won the most important award in the world. We're a global supply chain company. We're at that point, the largest in the world. Now, if you don't want to honor this man, we're going to move out of this little backwards town called Atlanta and go someplace where people got some sense. You got a week. By the way, shall I remind you, you're all vendors, my guess, of Coca-Cola. So, chop, chop. What you see, if you look at the history books of the King Honor in Atlanta, the place is packed with people standing along the walls. But that wasn't because people just had goodness in their heart. It's because leaders in the private sector said, it's going to hurt your wallet. It's going to hurt your social standing. It's going to hurt your professional ability to succeed in this city if you don't make sure that Atlanta is too busy to hate. The color here is great. And this is, and him getting this award is good for all of us. This has to become a movement there. And do what Doug McMillan and I have done. Get your biggest CEOs together and create a coalition of the willing. Put together a meeting and invite other CEOs to that meeting and give them something easy to say yes to. Financial literacy for all could be financial literacy for all Denver or Colorado. We'll do all the work as an example. It's easy for them to sign up to it. Or the 1 Million Black Business Initiative, where me and the SBA administrator signed up along with a $130 million commitment from Shopify to create e-commerce businesses of Black businesses. Again, we've already paid for it. We just need businesses to sign up or aspirants. But what we need are companies to say, I'll help commit 10 businesses. I'll create 5, 10, 20, 100 businesses throughout Denver. This, again, we'll do the work. But this is not just us. It's the Urban League. It's the United Way. It's Habitat for Humanity. It's the American Red Cross. There's a bunch of folks doing the work. What they need are folks who join them in a private-public partnership.
Well, I'm going to go back to a little bit of the conversation we were having before we started this session. Having lived in so many different places, I feel that Denver is one of the cities that is the most willing and prepared. Mayor, I think about some of the business leaders in our community and the conversations I've had with them about what we're trying to do, and the willingness, I think, to become part of this and to move forward. Just the what do we do next, I think, is what really holds out hope for me, that there are solutions and there are things we can do. Poverty is a solvable problem. Maybe not 700,000 people at a time, but one person or one family at a time is absolutely solving the problem. So we do have one question that came in the chat, and I probably will try to answer this. Private sector entities are taking DE&I and ESG pretty seriously, which seems to indicate a transition away from only making profit to providing goods in an equitable manner. With this shift, what do you think will be the future of healthcare? Will we ever reach the point where healthcare is considered a fundamental right versus a luxury to those that can afford it? And the answer has to be yes. I don't think there is any other answer to that. I think the question is, will the healthcare industry come to view itself and the way we function and the way we provide care as just not good enough? Because I think the answer is it's just not good enough. We cannot have people in our country going into bankruptcy because they got a hospital bill. And we know the average American can't afford a $400 payment. They are going to go into debt for that. So I
Yeah.
think the answer has to be yes. I certainly hope that what we're seeing is a transition away from only making profits. And that's easy for us because we don't make a lot of profits. But I think the answer has to be, do we really mean it? When companies talk about health and well-being and financial and economic opportunity, is it something that they mean or is it something that they say? And I'll go back to a comment that was made after the George Floyd murder, and we had all of the demonstrations. It wasn't only about the murder of George Floyd, as awful as that was. It was about so much more. And so the question is, have we really heard that message? And are we doing something, or are we just checking off a box?
Yeah.
I hope the answer is we're doing something. Mr. Bryant?
I know we're running late on time, but again, I love data.
Me too.
And the Business Roundtable, to that person's question, the Business Roundtable recently stated that the new definition of a corporation was to be to promote an economy that serves all Americans. So it's not just profitability anymore. The Business Roundtable is the largest companies in America.
Yeah.
So it's not some rinky-dink group. This is the Fortune 500. And this was done in 2019. And it also should be noted that after George Floyd murder, that corporations committed $52 billion with a B, in social justice commitments. So they're starting to realize that you can do well and do good too. These things are not mutually exclusive. And that your brand is important to your profitability, and people want to work someplace where they know that the company actually cares. I believe that that you're not going to see a turnaround. Social justice is now embedded. I call it social justice through an economic lens, is now embedded in how we do business, how we live. And the question is, what do we do at this moment? I believe it's a historic moment, but what do we do with it? And that's why I think this conversation that you've hosted is so incredibly important. And thank you for doing it.
Well, thank you. Thank you to both of you. I think this is really important. I think providing people a sense of hope for the future is what will change the conversation that we're having. It's what will give people the opportunity to participate in our society in a way that is good for them and for all of us. So thank you. I really appreciate this. I've got a whole bunch of notes of things that I want to think about how we can incorporate. And thank you, Crystal, and to the foundation for helping to organize this. These sessions are really intended to take on issues and to push us to do more, to do better, and to bring people into the conversation. So thank you very much. I really appreciate it.
Thank you all. And
Thank you
for joining us.
Take care, John. Take care of yourself.
Bless you, Mayor. Call me when you need me.
You bet. Take care.